Charlie. You were 32 when you first met with Pete Peters. I was 32 when I first ran for statewide office in this state, and I was beat 80-20. No wonder I listened to everybody after that. But you folks know how some of these Harvard law professors are called the Alfred Sloan Wigglesworth Professor of Law. I was kind of the Charles D. Baker, Lovett Peters Pioneer Institute Governor of Massachusetts. So we poached a series of executive directors from Pioneer: Charlie Baker, Steve Wilson, Jim Pizer, who were just massively instrumental in our initiatives. You know, they got started in the late 80s, and I started running in the middle of '89 for the 1990 campaign. And it was obvious by the time I was halfway through my campaign that Pioneer was a place that was producing first-class academic work without seeming at all academic. They were seriously cutting edge, and my administration, for good or ill, adopted virtually every complex proposal that Pioneer put before us and saved $500 million to $1 billion for the public fisc, and I think improved the quality of life in Massachusetts as well. We were all kind of foggy and intellectually curious when we took office. We were way young in January of 1991. I was the most curious of all because I knew absolutely nothing about state government, which I considered an advantage, and to this day consider an advantage for an incoming governor. But we wanted to go outside the usual circle of sources. We were very excited. There was a sense we could reinvent government, and we kind of did. My guru those days was, I think he's a Democrat, David Osborne, who wrote a book called Laboratories of Democracy. And just one tiny vignette. He said, well, you know, the returning soldiers after World War II had two sets of needs, education and health care. In education, Congress passed a GI Bill, which is the most successful domestic political program in American history, essentially a voucher program. And in healthcare, they went the other way. They went to statist mentality and said, well, if you want it, you've got to get it from the VA hospital. We're going to fund it. We're going to own it. It's going to be a great big red brick building. It'll say USA all the way. And you know, the people at the VA hospitals are as devoted as any public servants I've ever met, but nobody's really going to maintain that system of care is the equal of the system of care that's grown up in the private sector in the United States. And that was all I really needed to hear, to believe that organization and the delivery of government services can make a huge, huge difference. Pioneer was instrumental in our efforts, successful in Massachusetts in education reform. Of course, you had Steve Wilson and Jim Pizer and Charlie himself. And we did, you know, we followed the playbook. We cut taxes 21 times, and we took the unemployment rate from 10% to 4%. That was a good thing. And built a lot of infrastructure. I always had in mind the aggregate wealth of the state and the prosperity of the citizens. And I think that's a good sort of guide to keep with you. It's the counterpoint or counterweight to a drive to have government lead the way in growing the economy. Tonight we're going to see a real keen video of ideas that can become reality and did become reality, and I know that because in the 6.5 years I was in office, as I say, we adopted virtually every good idea from the better government competition that came to us. Just to tick off a couple, in 1991 we had reorganization of the MBTA. These are all winners of the Pioneer competition. And we privatized the MBTA's real estate management. I was, for my sins, the national chairman of the Privatization Council when I was in office. It was renamed the Public-Private Partnership Initiative 5 minutes after the Democrats won the presidency in 1992. But with me, privatization has always been a good word. In 1992, we had an environmental initiative out of Pioneer. We streamlined wetland permitting procedures and made the Commonwealth reuse a lot of wastewater biosolids, increased that by 15-fold. In 1993, there was a healthcare initiative, nurse-managed clinics, which improved access and cut costs, particularly in Western Mass. 1994 was the first salvo in welfare reform, which became a signature issue in Massachusetts when we introduced the work requirement for welfare, which cut the rolls by 85%. So a lesson there. But that was initiated by the Better Government Competition winner Bob Melia, who's Massachusetts Department of Revenue. And we supported, we strengthened the child support enforcement mechanism through that one. And that became a model for the federal statute. 1995, we had the pioneer winner for contracting out highway maintenance. It started in Essex County, then it was all of Eastern Mass. And we set the public sector, the unions, against the private sector to bid for highway maintenance. And you know, the private sector won 4 out of 5, but occasionally the public sector would, the unions would go back to the drawing board, sharpen their pencil, say we can do this for a lot less, and they won some. And just as I always said, I like it that charter schools have the freedom to fail. I don't want a fail-safe system. I liked it that the public sector, the unions, could win some of these highway maintenance contracts because it proves our fundamental premise, which is it's not public versus private, it's monopoly versus competition. And I think that's what to me, that's what the Pioneer Institute is all about. I'm going to cut it there in terms of the examples, but suffice it to say that the competition fostered in me, they used to say in Boston you can't fight City Hall, but Pioneer Institute has led me to conclude that you can fight City Hall and you can even change City Hall, and that can be done by just one person, you or any one of you, with a good idea, and that's what tonight is all about. Shawnee, let's roll the tapes. Thank you very much.